Hyperthermia is a type of cancer treatment which uses high temperatures up to 42 degrees Celsius. The body tissue will expose to the high temperatures and thus killing the cancer cell. It is usually used in combinations with other types of cancer therapy such as radiation therapy and chemotherapy. So now, we know that what HPT hyperthermia therapy is in general, but how does it really work in destroying the cancer cell? Let's have a look at the following animated clip to help us understand more. As heat is generated and absorbed by the body in HPT, the tumor responds to the heat shock and causes cellular changes. Under mild temperatures of 37 degrees Celsius to 42 degrees Celsius in HPT, it can lead to local vascular dilations, increased vascular perfusions, and improved oxygenations of tumors. This may enhance the sensitivity of tumors towards radiations and increase the delivery of chemotherapeutic and immunotherapeutic agents to the tumor. When high temperatures of more than 42 degrees Celsius is given, hyperthermia may lead to loss of cellular homeostasis, which result in cell cycle arrest, inactivations of protein synthesis, and inhibitions of DNA repair processes. This eventually leads to tumor cell death. From there, we know that HPT primary aim is to induce cell death through high temperature or heat. Now, the question is how heat is delivered to our body in HPT? Well, there are several techniques by which heat may be delivered. Number 1. Focused ultrasound, a technique generated by ultrasound probe to induce thermal ablation. The high-intensity ultrasound beam is capable of raising the temperatures at the targeted point up to 70 to 80 degrees Celsius for more than 1 second to induce cell death. Number 2. Induction heating. In this technique, heat is generated through metal rod and magnetic field. Last but not least, number 3. Magnetic hyperthermia. Heat is generated when magnetic nanoparticles injected into the body react and dissipate heat when they are placed in the alternating magnetic field. With the role it has to offer in cancer therapy, there are few approaches in the applications of HPT, which benefits different types of cancer, namely local, regional, and whole body HPT. Firstly, local HPT. The term local itself implies the heating of a very small area of tumor. The goal is to kill the locations of the tumor. This method is hence suitable for small tumors of size less than 3 or up to 5 to 6 cm. Regional HPT, on the other hand, works by heating on large area of the body such as the body cavity, organs, or limb. This approach relies on blood perfusions whereby the blood is removed from patient, heated up, and then pumped back to the patient body vessel. Its goal is to weaken cancer cell. Regional HPT is suitable for advanced tumor located in the pelvis, abdomen or thigh, cancer in the arms and legs. Lastly is the whole body HPT used to treat the whole body. It uses infrared hyperthermia by heating up to 39 to 41 degrees Celsius of the entire body by keeping them in a very hot room or wrapped in the hot and wet blankets. The durations include 3 hours of heating plus 1 hour of cooling, totaling up to 4 hours. Whole body HPT is usually reserved for treating metastasis cases whereby cancer has spread to other parts of the body. HPT definitely offers a distinctive role in cancer therapy. However, similar to chemotherapies and radiotherapy, the HPT therapy is not excused from several adverse effects. Some common effects include general pain and fatigue, blister and burns due to external heat application, diarrhea, nausea, vomiting, and other symptoms of sunstroke such as dehydrations and headache. Other effects may include increased risk of cardiac illness as well as swelling, blood clots, and bleeding with high level of HPT as the vasculature is generally heat-sensitive structures. Despite the effects, hyperthermia therapy effectiveness is significantly high, especially when being combined and used as supplementary treatments such as chemotherapy and radiotherapy. For instance, when combined with radiation, hyperthermia is effective at increasing the damage to acidic and poorly oxygenated part of tumor. This treatment is most effective when provided at the same time of within an hour of radiation therapy. Whole body hyperthermia, on the other hand, is more useful when used in combinations with systemic treatments such as chemotherapy and immunotherapy. Now, we understand what hyperthermia therapy is. Let's move on to the next segment whereby we have an expert with us to share her thoughts on the benefits of hyperthermia therapy.
Hyperthermia, rawatan yang tak pernah ada lagi dekat Malaysia kan. Dia biasanya rawatan ini digabungkan dengan rawatan yang sedia ada seperti kemoterapi dan juga sinaran radiasi. Sebenarnya dia memudahkan, dia memberi impak yang lebih kepada rawatan-rawatan tersebut. Contohnya kalau misal dia menambahkan kesan memudahkan kesan dari rawatan kemo dan radioterapi. Kadang-kadang onkologis akan memberikan ubat yang mungkin kurang kuat kepada pesakit, ubat-ubat kemo yang mungkin ringan sikit, sebab hyperthermia itu dah menambahkan impak kepada rawatan kemo itu sendiri. Sesetengah rawatan alternatif dia akan menggunakan hyperthermia yang tidak akan memberi efek pada sel-sel sihat. Contohnya dia akan buat gabungan antara hyperthermia dengan pemberian dosage vitamin C yang tinggi ataupun pemberian B12, terapi ozon atau terapi oksigen. Hyperthermia, teknik dia tu akan memberikan impak berganda rawatan misalnya kemo dan juga sinaran radiasi, dan juga dia mencegah daripada kemungkinan kebarangkalian kecepatan untuk dapatkan metastasis.
Overall, the HPT definitely provides a definite role in treating cancer. Today, the development of new treatment approach is never ending but rather a continual process. Hence, it is possible that we can expect a shift from the conventional treatment method to newer and better development of treatment approaches in cancer therapies in years to come. Thank you for watching.